There are certainly children who will present with a history of snoring. You want to examine them, see what the issues are. There's a strong correlation with obesity, particularly with the epidemic we have now with obese children. By far the commonest association I have is just enlarged tonsils and adenoids, what we call tonsillar adenoidal hypertrophy. That doesn't always produce obstructive sleep apnea or even snoring, and we certainly see kids with what we call kissing tonsils, where they touch in the midline, and those kids breathe fine and don't have any problems, where others do.